Hi, I'm Dr. Jose Lara from Gonstead Physical Medicine. And if you have been told that you have a herniated disc and the only solution to that herniated disc is spinal surgery, and you are not certain about it, we are more than happy to give you a complimentary MRI review and give you our opinion of whether the surgery might be the best way for you to go, or is there another option. One option that we utilize at Gonstead Physical Medicine is called the non-surgical spinal decompression DRX9000. It's a machine that was made to treat compression to the disc or herniations. When the disc in this particular model, as you can see, you have the spine, the disc, and another vertebrae. When the disc is compressed and the disc comes out as a herniation, the non-surgical decompression machine pulls it back out and retracts the disc. The DRX9000 is very effective for that. So not all cases need surgery, some do, some don't. I want to show you a particular case of this person that had severe lower back pain with left leg sciatica, was sent out for an MRI, and this is a side view of that particular MRI. In here we have the abdomen. We're looking at the spine from the side in this particular way. In here we have a normal looking vertebrae, and in between that we have the disc. This structure right here will be equivalent to the yellow structure in this particular model when the nerves come out and those nerves go to the lower extremities. As you can see, no structure should change color. The light gray means normal. The darker gray means that the disc is being compressed in this manner in a T2 weighted image, which is MRI is. As you can see, the disc is a little darker in color with a protrusion or herniation at this level. At the L4 level, the disc got way more in darkness, and you can see a large herniation going forward down from the other vertebrae. So this is a very large herniation, and you also had a herniation at the L5. So this particular case had two herniations with one bulge. The L4 and L5 make up the sciatic nerve, and that was the root cause of the problem. She was told the only solution to treat this condition was surgery. She was afraid to go through that process, so she came to us. We did an MRI review, and were able to treat the condition through the non-surgical spinal decompression, the DRX9000. She went through the protocol of several weeks of treatments, several times a week. She finished well. Pain was almost completely gone, left leg normal. She will come in from time to time for a maintenance, whether it's a chiropractic adjustments or perhaps a decompression. She happened to have an injury 2 years later and created some of the similar pain at that level, but not to that degree. So 2 years later, she was sent out for another MRI, and this is that MRI. As you can see, the prior herniation, even though through an injury, is retracted from where it was. The L5 is almost no herniation, and a very mild one at L3. So from prior MRI, from a huge herniation to another herniation, 3 areas, to basically a little bit of a bulge, she had great results. We treated this again with great success. So if you're thinking about considering spinal surgery, and you're not sure if that is the best way for you to go, we are more than happy to give you a complimentary MRI review and our opinion if the DRX9000 is a good solution for you or not.